Hello, my name is Sandra Labib. I'm student pharmacist on class of 2023. My article is about baricitinib plus remdesivir for hospitalized adults with COVID-19. Andre Seike, Thomas Appy, NHKMAL. The article was found in the New England Journal of Medicine. The reason why I chose this article is because I work at a hospital, and once we seen COVID-19 patients, we started to give all of them remdesivir, but I haven't seen baricitinib, and I was really curious if there's any superiority giving the combination therapy or not. I was just really curious, and it caught my attention. The primary objective for the study is to measure the time of recovery in hospitalized COVID-19 patients using the combination therapy of baricitinib plus remdesivir versus the placebo group, which was remdesivir alone. Primary efficacy measure was the time of recovery within the 29 days. So the recovery where the patients who are not hospitalized, they have no limitation, or they're not hospitalized, but they have some limitation, or they require home oxygen. Or finally, if they are hospitalized but they do not require supplemental oxygen, or they have ongoing medical care. Secondary outcome measurements were a lot, but the ones that I focused on were the duration on hospitalization and also the duration of the oxygen use. The study design is a phase 3 trial, multi-center, randomized one-to-one double-blind barrel assignment trial. It targeted the patients who are hospitalized with COVID-19, and they visited them on day 15, 22, and 29. For day 15 and 29, they were preferred to be in person because they have done lab values, swab, the oropharyngeal swab, and blood samples. For some patients or subjects, the infection control and other restrictions limited them to come back in person to the clinic. And in these cases, it was done by a phone, and only the clinical measurements were taken. Day 22 also did not include any lab values or tests or collections, so it was also done by a phone. And this is just a table that would summarize what happened in the 3 days, and then also they here talked about the ordinal score. I will talk more about it later, but it basically means the severity of the complication of the COVID-19 in on the patients. Now, subjects are who are hospitalized with symptoms of COVID-19, aging between 18 to 99. For inclusion criteria, it was that they have the symptoms of COVID-19, informed consent, also understand and agree to comply by the study procedure. Male and non-pregnant females are equal to or more than 18 at the time of enrollment. Also, a confirmed lab test, PCR, and the illness of any duration that was okay, and with one of these, so if they require supplemental oxygen, mechanical ventilation, the blood oxygen less than equal to 94% on room air, and then also imaging of the radiographic infiltrates. If they are women of childbearing age, they must use contraceptive besides, not including the hormonal contraceptive, from the time of screening. Also, they agree not to participate in other clinical trial for the treatment of COVID-19 in the 29 days. Exclusion criteria is very detailed and long, but basically anyone who are at risk of further complications from these combination therapy. Also, if they're on dialysis, low eGFR, allergies from the medications, if they are immunocompromised patients, also if they are on immunosuppressants. And I have here the list in details attached. And the length of the study is 29 days. For monitoring parameter, for the primary outcome, they looked at the patients who are no longer hospitalized with no limitation on activities or discharged without home oxygen, hospitalized, but they don't have any supplemental oxygen. For secondary outcome, they looked at the oxygen level and the need for ventilation is monitored, and also the duration of the hospitalization and whether or not they need new oxygen use, new ventilator use. Side effects were also being monitored, and it was divided into aspects. One considered serious or severe side effects, and none are considered non-severe side effects. And then I have here some examples of what was considered severe. So cardiac disorder, multiple organ dysfunction, AKI, acute respiratory failure. Also later I have a table with a breakdown of the side effects and the results. And finally, the mortality among those patients were also monitored. Data analysis. So the intent to treat study designed for primary outcome to achieve 85% power and that detect recovery ratio of 1.35. They needed 518 and both groups, combination versus placebo. They got 498 subjects received the combination, 495 received the placebo. Power was met. The primary outcome with p-value is equal to 0.03. And the 28 mortality was 5.1% in combination group versus 7.8% in the control group. Also serious side effects in the combination group versus control group was 16 versus 21%. The data analyzed here, the number of recoveries, it was a ratio type of data, and they looked at the log rank test, and that was appropriate for this aspect. Also the number of mortality, and they used the interval Kaplan-Meier, and that was also appropriate to look at the mortality. So the results, it was shown that the combination treatment, percitinib plus remdesivir, has a mediation of 1 day faster than the patients who received the remdesivir alone was a placebo. Maybe a value of 0.03 by log rank test. And in here, there's further breakdown on the ordinal score that I talked about previously. So score of 6 are those who are receiving non-invasive ventilation, high oxygen. Also score 4, which means no oxygen, 5 supplemental oxygen. And then overall, it showed better outcomes for combination therapy versus control. Looking at the mortality using the Kaplan-Meier estimates at 14 days after randomization was 1.6% in combination group and 3% in the control group. And this is a more detailed table of what I just talked about, breakdown of the ordinal scores along with the recovery. So this is the log rank test. And here, this is the Kaplan-Meier that estimated the mortality. So for example, here, the overall percitinib plus remdesivir showed a higher proportion recovered than the placebo versus the placebo plus remdesivir. And then there's further breakdown depending on the ordinal score. Tolerability, serious adverse effects were less frequent in the combination group than the control group. So it was 16% versus 21%. And then this is a list of the serious adverse effects. And then here, this is a list of the non-serious adverse effects. Author's conclusion and quotation, percitinib plus remdesivir was superior to remdesivir alone in reducing recovery time, improving clinical measurements when COVID-19 patients. Also, the combination showed fewer serious adverse effects. The superiority was showed in both primary and secondary outcomes. However, there was improvement in the secondary outcome more than the primary outcome. The survival rate and the time of death was also favored in the combination therapy. Strengths of the study, power was set and met. They used the appropriate biostatistical tests, the log rank and the Kaplan-Meier. Also, they looked at the appropriate and primary and secondary outcomes and the measured they followed were valid, adequate criteria for the recruiting patients and also for the excluding patients, proper randomization that resulted similar group for 98 versus 495, treatment regimen, the dose according to Lexicomp, it's in therapeutic range and within safe. Also, author conclusion was supported by the results. Now, for limitation, the hypothesis was not found anywhere in the study, so hypothesis isn't clearly defined. Also, there weren't any system-wide changes that were reported in the study. And the trial was seen, analyzed, sponsored, and revised by the NIAIDS Division of Microbiology Infectious Disease. This study is a level 1 and it has a minor limitation. My recommendation, I recommend the use of paracetamol plus remdesivir in patients who are hospitalized with COVID-19. And my recommendation is based on the following. So efficacy, it looked like the combination therapy showed a higher recovery rate. It was a 1-day difference, but in p-value of, sorry, 0.03. It's in terms of COVID, the faster we limit it, the better, even if it's 1 day, just to reduce the risk of spreading it. Also, safety, there were less serious side effects in the combination group of 16% versus 21%. For cost, I couldn't find the cost for paracetamol in Micromedics Red Book, but I found for remdesivir. However, remdesivir was used whether by itself or with the combination therapy. So another cost I looked at was mortality. So the mortality rate was higher in the control group than the combination therapy. It was 7.8% versus 5.1. Special consideration population, there were no serious cardiovascular adverse effects in the combination therapy. However, GAK inhibitors are associated with immunosuppression, secondary infection, and thrombosis. So adding the paracetamol showed lower incidence of these side effects and thromboembolic events. Thank you so much for listening to me in my journal club. If you have any questions, please feel free to email me, labibs27@dyc.edu. Again, it's labibs27@dyc.edu. Thank you and have a great day.